Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hi, Dr. Luper. How are you?
Hello, Haley. I'm doing good. Feeling good.
Good. Well, starting this month, I think it would be beneficial for us to talk about anemia. It's something that we see in the practice quite often, and I know that there's a lot of people out there suffering from it. So can you start us off by telling the audience what anemia is?
Certainly. Normally what drives this anemia conversation is it's a symptom of tiredness. People come in fatigued. They come in, just generally tired, particularly if they try to do anything physical. They try to exercise or something. It just sucks the energy out of them. If it's really bad, they'll come in looking pale. Mm-hmm. And they got this kind of pall of, life's a drag, and they're grinding their way through it. So it turns out that anemia is common, but it's not usually what you think, because most of the time you think of anemia, you think of iron deficiency, and that certainly is one of the causes of anemia, but it's by far not the most. I mean, it's not all of anemia by any means. Mm-hmm. So let's before I go into the talk about anemia, like what it is and how to fix it and all that stuff, let me just kind of talk about the main things we look at with anemia. Anemia is in practicality, it's a decrease, or rather an insufficiency in the oxygen carrying capacity of the blood.
Okay.
Now, in order for blood to work correctly and for our bodies to feel right, we need to take oxygen from the atmosphere and transport it to our cells. Now, you'd think that maybe oxygen, since it'll dissolve in water, could dissolve in our blood, just, in the liquid part of our blood, and be carried to our cells. And certainly there's a small amount of oxygen that'll do that, but it is absolutely insufficient for our needs. We would all die. We would all be basically cold-blooded worms trying to, right. Mm-hmm. So that's not going to work. So what our body does is has this device, this system set up, where there's these little boxes that have a piece of iron in the center of them, and oxygen likes iron. It attaches to it readily. This is called rust, by the way. And so it jumps on, attaches to the iron, and then gets transported to our cells, jumps back off again. We've talked about this before in terms of getting that whole system to run better by getting carbon dioxide levels to come up in the blood.
Right.
Not everybody saw that show, so let me just talk about that a teeny bit. In order for the oxygen transfer to take place, the oxygen needs to jump on to the little iron atom inside this box, known as hemoglobin, and then once it gets to its destination, to jump back off. Mm-hmm. Now, jumping on is easy because things rust all on their own. You don't have to add any energy to it. It's just a natural state of iron to be as oxidized. It's the jumping off that's tricky. Now, in order to facilitate that, the removal of oxygen from the iron, the box is designed to be able to twist and push that oxygen off. And how it does so is there's two little slots at the bottom of the box that fit carbon dioxide in there. Carbon dioxide it attaches and twists the box, and boop, the oxygen pops right back off. So in order for this whole system to work, you need to have plenty of these little boxes. Mm-hmm. You need to have the container that carries all these boxes. It's a red blood cell.
Yes.
And you need to have enough iron to be able to make the boxes. The boxes, again, are known as hemoglobin.
Now, I thought anemia was a decrease in the amount of red blood cells.
Yeah, yes and no. Not always.
Okay.
It could be that the red blood cell numbers are fine.
Okay.
And you still have anemia.
Okay.
And what that would be is there's a deficiency in the amount of hemoglobin.
Right. Which is
so these red blood cells don't carry the oxygen. It's the hemoglobin that carries the oxygen. The red blood cells carry the hemoglobin. Mm-hmm. Again, the red blood cells are a big circle packed full of millions of these little hemoglobin molecules. It's the hemoglobin that's actually doing the work. So let me give you an example. There's an anemia where there are plenty of red blood cells, but all of them are too small
Okay.
because there's not enough hemoglobin. That's a kind of anemia.
Is that sickle cell anemia?
No, that's actually not. That's iron deficiency anemia.
Oh.
So sickle cell is another kind of anemia altogether.
Mm-hmm.
You're going to make me tell everything once. Let's go back and go through the other aspects of anemia. So deficiency in red blood cell count, deficiency in hemoglobin, or both.
Okay.
Now, the red blood cells could be too small and they don't have enough hemoglobin, or they could be too big and there's not enough red blood cells. There's plenty of hemoglobin, but there's not enough cells to carry it.
Mm-hmm.
So the problem with the cells are too small and there's not enough hemoglobin turns out mostly to be a problem with iron. It turns out that the rate limiting factor in making hemoglobin is you got to put the iron in the center.
Okay.
And without the iron, then you can't make the hemoglobin. The body simply won't do it. It's a necessary component to build the whole molecule around. It's the core.
Mm-hmm.
And without that, you can't build the hemoglobin. So in those people, what you need to do is get iron levels increased.
Sure.
So let's talk about that. How do you do this iron thing? No, the way to find out if somebody's got an iron deficiency is to run a blood test.
Okay.
They'll be tired, they'll be pale, they'll have lack stamina, but that's just suspicious. It makes you think of maybe they got anemia, but to really
Right.
prove they have anemia, it's going to take a blood test. And that blood test is mostly going to show that the red blood cells are too small, and it's definitely going to show that the hemoglobin is too little. That's one of the test numbers that come, is how much hemoglobin do you have. There's another way to measure this, kind of an old-fashioned way to measure it, and that is how much volume does the red blood cells and all the hemoglobin inside them take up in your blood. And so what you do is you take the blood sample and you spin it in a centrifuge, and all the red blood cells go to the bottom and they pack in,
Mm-hmm.
and then you simply measure how long that column is compared to the total column, and you get a percentage. So if a normal percentage of red blood cells packing is somewhere around 45%, if you get less than 40%, you got a problem. You get into the 30s, you absolutely have a problem. Again, if you get above 50%, then you have a different kind of problem. You have too many red blood cells. That's another thing altogether. We won't talk about that.
So if you're drawing a patient, I'm just curious for my own knowledge because I do blood draws. If you're drawing a patient and they have too little red blood cells, will it still fill the vial?
No,
Okay.
it won't.
Yeah.
So if the numbers of red blood cells, if they're low, it won't fill. That's
Okay.
anemia. If the amount of hemoglobin inside the cells, which makes them smaller, so there's plenty of them, they're just not that big, they pack tight,
Okay.
that's anemia too.
Okay.
And the name of that is called hematocrit. So that is one of the ways that the information is going to be presented, is for us to look at a hematocrit. The more accurate number is actually looking at the hemoglobin itself, because the hemoglobin is the business end of this whole system. That's what's actually carrying the oxygen in. So how much hemoglobin you have is how much oxygen carrying capacity you have, assuming that the hemoglobin's all working, which is usually the case, but not always. So anyways, one of the more common individual causes of anemia is the fact you get iron deficiency. And the reason for that is mostly because some parts of our population bleed. You know, women get a menstrual cycle, and so they
Yeah.
lose a certain amount of blood, and there's iron in that. And so there's a monthly trickle of iron out of your system. Unless you're putting that back in, you're eventually going to end up
Depleted.
depleted. You're just kind of, losing a little bit now, a little bit later after that, and pretty soon you're low. So the standard treatment on that one is to supplement iron. The old-fashioned way of doing that is to take a pill called iron sulfate. The problem with that is it doesn't work very well. The iron's not really very well absorbed. It causes constipation. It's kind of a drag way to do it. Fewer and fewer doctors are actually doing that anymore. They're kind of wised up, and they're doing iron that's chelated. It's iron 8, iron citrate, iron picolinate, some kind of iron with an 8 on the end of it. The 8 is a molecule that allows the body to grab it and pull it in, so the absorption's better, there's less side effects, there's less constipation. It tends to work really well. It's cheap and easy to get a hold of, so it's a great way of getting iron into people. Now, not everybody wants to take a pill. Not everybody needs to take a pill.
Mm-hmm.
So there's other ways to get iron into people as well. Kind of a classic standard way to do it is to cook out of a iron skillet.
Yeah, that's what I've heard.
Cast iron. It'll work.
And to eat bloody food, to eat red meat.
That's another way to do it.
Yeah.
If you're losing blood in one way, you can get blood back the other way.
By eating it.
Blood sausage, yum. So, anyways, the trick of the cast iron, though, is you literally have to scrape the iron off the pan.
Yes.
And so if you get a cast iron skillet and you're using a nylon spatula,
No, you got to
it
use
just
metal
slides.
on metal.
And then it's not going to take it up. You got to get a metal on metal. You got to use a metal spatula and then scrape it occasionally.
And if you're using a nylon spatula on a cast iron, you're not going to get what's on the pan.
There's that as well.
It's not coming off, yeah.
You know, cast iron really cooks well. It holds heat well. It's a little slow to heat up, but once the heat's there, it cooks beautifully. So you could really do a great job cooking. Once also it gets cured, it gets a layer of crusty oil on it, and it's fabulous. It's almost like a non-stick skillet.
Seasoned, yep.
Yeah, you get a good seasoned cast iron pan, and it'll cook just about as good as any pan around. Now, the tricky thing is you can't wash it with soap.
Yeah.
You wash it with soap, you strip the oils on it, and now you're back to a rusty pan.
Right.
So you got to clean it. You can scrub it, but without any kind of detergent on it. So, anyways, that's an easy way to solve an iron problem. Now that assumes that people have the capacity to absorb the iron. Now, to absorb iron, the iron has to run through an acid bath, and what the acid bath does is it strips an electron on the outside of the atom and makes them sticky, so our body can grab a hold of them and pull them in. Without that acid bath, the absorption's really low. So a lot of times the people have anemia and they say, I took iron and didn't do anything. It didn't fix me. But their blood shows that they have an iron deficiency. The way the blood looks, the size and the shape, the way the hemoglobin is, it's clearly an iron deficiency. These people, a lot of times, are really just not treated correctly. In regular medicine, they don't really know what to do with them. But years ago, I figured out how to treat these people. So when they show up now, it's like, no problem. What I do is I have them take hydrochloric acid in pill form. And so when they eat, and they have them cook out of a cast iron skillet or just take iron, and they have to take the acid with the meal or with the pill, and then the acid will activate that iron to get it to be absorbed, and you can cure people with a iron deficiency that's resistant to being treated with iron. It's interesting. Turns out hydrochloric acid is necessary for iron absorption.
Okay.
Okay. There's another thing to keep in mind too when the iron's low. Sometimes people have a chronic infection. They have infection in their digestive system, or they have infection in their sinuses, or they have this kind of low-grade infection that just lingers for weeks or months or even years. I've had people that have infections for years. And so in that situation, the body's sensible about iron. It knows that iron stimulates, fertilizes is maybe the better word, bacterial infections. Bacteria need iron too. Without that iron, they can't grow easily.
So if there's already an existing infection, then the body won't take the iron from the red blood cells?
Now, what it does is it hides the iron.
Oh.
The fancy doctor word is sequester.
Oh.
So the body will sequester iron.
Because the bacteria takes it?
And it's hiding it from the bacteria.
Oh, okay.
So it doesn't want the bacteria to get it. So what it's doing is it's weakening the bacterial metabolism so that the body will survive the bacterial infection by sequestering iron.
Where does it go?
It gets stored in your bones, it gets stored in your liver, it gets stored in places in different forms, in kind of long-term storage forms. And so it just gets packed in your body.
Is
in your
it
connective
obtainable after the infection is resolved?
Yes.
Or okay.
It could get brought out of storage and put into circulation, assuming the infection is gone.
And does that lead to any iron poisoning or?
No.
Okay.
No, the problem here is you go to the doctor runs a test, finds out that you're anemic, can see that it's an iron deficiency, and so what they do is they put you on iron. Now the iron they put you on fertilizes your infection, and now you get sicker because you're taking iron.
Yeah.
I've seen this happen.
Yeah.
Patients have come to me with horrible digestive infections, and they're taking iron based on the fact that their body was hiding that iron to solve the infection. So what I do in that case is I take them off the iron, I treat the infection, get it cleared, and then put them back on iron, and then it'll work.
Okay.
So just by the way, it's not a common problem to see, but if I've seen it, a dozen times, it's common enough for me to mention on the show.
Sure. Now, I had a question on hydrochloric acid. You said that you put patients on that type of supplement. Is there anything that they can do, like food-wise, to increase that in their...
The acid?
Yes.
Yeah, you could just take apple cider vinegar or any kind of vinegar, really. It doesn't have to be apple cider.
Kombucha.
Yeah, vinegary things.
Okay.
Kombucha's kind of weak.
Kimchi, sauerkraut.
Yeah, those are all kind of weak acids. They're not particularly the best, but they might be helpful enough. Really, the stronger the acid, the better results you're going to get, short of having to be, burning acid. We don't want that. But you get acid in your system, and it'll strip those electrons, and your iron absorption will go up. So you can get food sources as well. They're okay. Sometimes they're going to be good enough. Sometimes they're just not going to be adequate to be able to get enough iron into people. So it's a case-by-case kind of thing to figure out exactly what's going to do it.
Okay.
Okay, so let's talk about another kind of anemia. This is a kind of anemia we mentioned earlier where the body makes really big red blood cells. Now, the reason why it's making really big red blood cells is because it can't make enough. Now, in order to make cells, you have to make DNA, because DNA doubles and then the cell divides. And so red blood cells start with full complement of DNA. And then without that, they can't divide. So in order to make DNA, you need vitamin B12 and you need folate. So if you have a B12 deficiency or a folate deficiency or both, then you can't make enough cells. Your cell division is inhibited. So since our bodies need to, move a lot of oxygen, what it does is it takes the hemoglobin that it can make and just puts more in the red blood cells. Now, this sounds great because it compensates for the deficiency in red blood cells, except for there's a rub. Of course there is. The rub is the pipes that move these red blood cells are the same size.
Okay.
and the red blood cells are bigger.
Yeah.
They don't fit
Do
easily.
they get clotted?
No. What they do is they just won't get bigger. They literally have a hard time going through. And if you get enough of this, your blood pressure can go up. But mostly what you get is a certain size, and that's it. Our body's not stupid. It won't make them any bigger than that. And so you just get these really big red blood cells that just are behemoths, really is what it is. And the oxygen carrying capacity is kind of pushed to the limit is really what it is. Now, the real problem here isn't that they're too big. It's that there's not enough of them. And so the easy solution to this is to take B12 and folate.
Okay.
And now you have an abundance of B12 and folate. You can make plenty of red blood cells. Now the size comes down smaller, and there's just more of them, and then boom, the problem is solved. Except, here's the trick. There's usually a trick,
There's
right? There's a trick.
There's always a
The
catch.
trick is, in order to absorb B12, you have to have a molecule that's made in your stomach called the intrinsic factor. Without the intrinsic factor, the B12 just passes right on through. You'll take it, but you never absorb it, and you just poop it out later. So intrinsic factor is necessary for the absorption of B12.
So how do you determine if somebody has that intrinsic factor?
You can test them
Okay.
and see if they have it. In the cases I found of people didn't have intrinsic factor, they all had a certain kind of gastritis where the lining of the stomach got real thin, and it's usually in old, frail people. It's a relatively common occurrence in old, frail people. I mean, of all the populations that get this, those are the ones that most likely are going to show up with it. And the solution is pretty straightforward. What you do is you heal their stomach. And then they start making intrinsic factor. The other thing you can do is if you're having, like, in healing their stomach is taking a while, there's an easy solution to this for a doctor. And that is you put the B12 in a shot and you put it into their bloodstream. That way it doesn't have to be absorbed. It's already in your bloodstream.
Okay.
And it takes care of it.
Yeah, but not everybody has access to injections like that.
So if you can get the injections, it's quick and easy to fix on this thing. But the way to treat it is get people's stomach healthy again. And then we've done shows on that. That's doable. So anyways, there's the B12 deficiency and the folate deficiency will cause this large red blood cell type of anemia.
Is there a name for that type of anemia?
Yeah, it's megaloblastic anemia, or something. I'm drawing the blank on the name. I have this stuff in my head. Anyways, it'll pop up again. So the red blood cells are too big. Okay, so there's another type of anemia, and that is anemia of chronic illness. Now, it turns out in order to make blood, you have to make cells. We talked about that already.
Sure.
In order to make cells, you need energy. Now, you need B12 and you need folate, but you need protein and you need all kinds of stuff. I mean, it just turns out to be like a lot of material to make blood. And so if your body is sick and it's weak and its metabolism is running slow or damaged or not working right, then you can't make enough blood to meet your body's needs, and so you get anemia. Now, the anemia is not caused by iron deficiency, and it's not caused by B12 deficiency, and it's not caused by anything that's obvious. It's not vitamins, it's not anything. It's just you're tired. Now, this is a catch-22, because the more tired you get, the more anemia you get. And the more anemia you get, the more tired you get.
Yeah, it's a vicious cycle.
Yeah, and down you go.
Yeah.
And so the solution to this problem is very straightforward. You get them well again. You heal them. If it gets really bad, a transfusion is used.
Okay.
Now, doctors don't want to use transfusions because they don't want to put someone else's blood in you.
And there's not enough blood really out there to put into as many people that need it.
That's true.
Yeah. There's a shortage.
Yep. And so we try to do the best we can to fix this without actually having to do transfusions on people.
Sure.
But if it really gets serious and your blood is really, really, really low, you can't turn this around. So you have to do a transfusion. So I've had patients who had this, who needed transfusions. You just kind of recognize when they get to that point.
And
then
how do you recognize when it's that point? Are there test levels at a certain number?
Yeah. So you're looking at the hemoglobin, and the hemoglobin gets below 7, somewhere around there.
Wow, that's low.
Now, normal hemoglobin's running, 12, 13.
Okay.
And so, yeah, you get below 10, you got a problem for sure. You get below 7, 8, you absolutely have a problem. I've seen patients as low as 6 before, and that patient I sent in to get a transfusion.
Okay.
And she felt much, much, much better. It was easier to turn her whole case.
So after they get the transfusion, then you work on the actual healing.
Yeah, whatever the problem is. Normally what they have is a low-grade infection. Remember that iron sequestration that we talked about? They have that.
Yeah.
And so they grab the iron, they go anemic, and then they can't get out of the hole that they dug themselves into. And then you got to really treat the infection at the same time.
Have you seen or experienced anybody who's had to go in for reoccurring transfusions because
Yes.
their body just won't hold?
Normally what happens in those people is they bleed. They got some kind of digestive problem where they're actually bleeding into their...
Internally?
Yeah, internally into their stool. So they pass blood when they poop, and they're losing, blood daily. It's not
Right.
just like you lose a little bit on your period. You lose some today, and you lose some tomorrow, and you lose some the next day. It doesn't take much time at all for you just basically run out of the materials to make enough blood. So that's usually what drives that particular thing. Now, there's another cause of anemia that we see a fair amount here too. It's not that common, but common enough to show up in our practice, and that's people with kidney disease. So the kidneys are important in the making of blood because there's a hormone that they make, erythropoietin, that it needs to be there to kind of trigger the whole process of making blood. There may be a call for blood, but without the erythropoietin, that call is unanswered. And so the erythropoietin is necessary to be able to fix this problem. And it's made in the kidney. And so if the kidney is damaged, then the ability to make erythropoietin is diminished. And so if the damage is extensive enough, then people just can't make enough erythropoietin.
Is that a separate test as well? Can you check the erythropoietin
Yes, you can.
levels? Okay.
And the good news is that erythropoietin has been manufactured, so you can actually get it and do an injection. Now the problem is, years ago, this was abused. Nearly everybody who had anemia could get erythropoietin, and there's all kinds of horrible side effects, and it was killing people. And so it's much better regulated nowadays, and only used when it really needs to be used. And it's really that case is real straightforward. It's when there's kidney failure.
Okay.
So we had a patient we saw today who got a shot a few days ago.
Okay.
And she's doing a lot better for it. Because now she's making more blood. Her energy came up. She's feeling better. She's doing really well.
How often do they get these injections?
Only when they're needed.
Okay.
Not regularly. Basically, the blood tests are watched as the hematocrit goes down and the hemoglobin goes down, the red blood cell count goes down. It gets to a certain point and it triggers it. Just like the transfusion story. Except for getting a transfusion, what they get is a shot of erythropoietin, and that brings it all back up again.
Okay.
Okay?
Yeah.
All right, so let me see if I missed anything. Oh, golly, I did. I missed a bunch of stuff. So when we talked about the metabolic rate in our bodies needs to be adequate to be able to make blood.
Yes.
Okay? Then we could think of things that slow down your metabolism, and all of those things are associated with anemia. Can you think of any? Slowing metabolism. Classic reason for people to have slow metabolism. Cold, tired, slow.
Their thyroid.
That's right. I knew you had it in you.
Yeah.
Exactly.
And that's what I was thinking when you were talking about the erythropoietin, is how that medication might affect patients' thyroids.
Yeah, so it's not really, to my knowledge, doesn't have an effect on their thyroid. What it means is the thyroid has effect on the blood
kidney.
production.
Yes.
Yeah, so that's the problem.
Okay.
The metabolism is so slow, they're cold
Yeah.
and slow, that everything just runs slow, and so they're making blood slowly. And it's just not enough to keep up with the turnover.
The regeneration
a
of
red
it.
blood cell has a lifespan of about 3 months.
Okay.
And if you're making lots of them, you can keep up. If you're just making a handful, eventually you're just going to run out. You just can't make enough to replace the ones that are dying based on wear and tear. Mm-hmm. That's what hypothyroidism is about. So the treatment for that one isn't to put them on iron, isn't to put them on B12 or folate, because that's not really the problem. The solution is to heat them up. Mm-hmm. And if you get them to supplement thyroid hormone, whoop, there you go. Your metabolism goes up and you're good to go. Mm-hmm. Probably. We do know a fair number of patients who really don't respond well to thyroid. It turns out their metabolism is broken in other ways. So there's a tricky thing here. Most people who have low thyroid do find by taking thyroid, and there's a minority of people with low thyroid, you put them on thyroid and they get worse. They don't get better because their metabolism can't take it. Those people, the reason why their thyroid is low is because their metabolism is broken. It's not their metabolism is broken because their thyroid is low. Mm-hmm. So it's a different thing altogether. You got to treat the metabolism to get it to turn. But those are a minority.
Well, I think that's all the time we have today, Dr. Luper.
All right. Hey, it's always a pleasure.
Absolutely. Thank you.
You're welcome.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.